Another problem the administration is facing is getting health care reform up and running. Under mounting pressure, it is now delaying until after the congressional elections next year a key part of the program, what's called the employer mandate. Wyatt Andrews has more on that.
As the managing partner of the Hotel Bethlehem in Pennsylvania, Bruce Haynes was relieved to hear he will not be penalized next year for the workers he says he can't afford to offer health insurance. The one-year reprieve saves him at least $50,000 in fines and a mountain of paperwork.
This is an administrative nightmare for business. There's unintended consequences of this bill in terms of for employees. It's not as simple as more people are going to get health insurance.
The health reform law called for businesses with more than 50 full-time workers to provide health insurance this January or pay a fine, with a full-time worker defined as anyone who works more than 30 hours. That rule has led to layoffs and has impacted hiring. The Hotel Bethlehem does buy health insurance for most of its workers now, but to save money under the 30-hour rule, new workers get fewer hours so the hotel can avoid buying their insurance.
We hire only part-time employees with the understanding that they will be working less than 30 hours a week.
Businesses also complained about the monthly reports on who was part-time, who was full-time, and what insurance they carried. The administration finally agreed it would take a year, suspend the fine, and reduce the paperwork. White House spokeswoman Jennifer Palmieri.
If we've encountered a problem, we try to address it and be flexible in how you would implement this.
This is a setback for an administration that's insisted for a year that health reform would be implemented in full and on time. But, Jeff, this does not impact the ability of workers to buy health insurance. This expansion of insurance to the uninsured next year, that's unchanged.
Wyatt, we've talked policy here. What is the further political fallout for the administration?
Jeff, right now, this is a gift to Republican critics who've argued that the health reform law is too complicated and too much of a burden on businesses. Republican leaders are already saying this proves their point. They're planning a full investigation on how this decision got made. You can already see this becoming an issue in next year's congressional elections.
Wyatt Andrews, thank you.